All right, in the last section, we were protracting our scapulae, doing push-ups with a plus with the serratus anterior. We've got them protracted. Now we've got to get them back retracted, right? So we need to know what the scapular retractors are. Same learning objectives, no surprise. We're always telling people to retract their scapulae, and even you could even say pull them back and down. I say that to a lot of people. Scapular retraction is often referred to as pinching your shoulder blades together. It's linked to upper extremity movements such as rowing or pulling or starting a lawnmower, old-fashioned kind of lawnmower. So pulling, when we're picking fruit from the tree, we have to retract our scapulas. We pull it back down. When you're picking something up from the ground, same thing. So very important linked movement. Primary scapular retractors are the rhomboids and the middle trapezius, but the other trapezius muscles, upper and lower trapezius, can also help because they all have that line of pull together. They can all retract the scapulae together. So the middle trapezius, it's those horizontal fibers that go from the spinous processes of C7 to T5. And attach, their insertion is the medial aspect of the acromion process. So as you're going around the corner on the acromion process, basically, they do scapular retraction. Look at that line of pull. That's what they've got the line of pull for. And the whole trapezius is innervated by cranial nerve 11, the spinal accessory nerve. The three parts of the trapezius are synergists for retraction. So the upper and lower are antagonists for elevation and depression and agonists for upward rotation. So they can kind of neutralize the elevation and depression and the upward rotation to get pure retraction. Pretty cool, right? So the rhomboids, of course, they have that nice little medial lateral line of pull deep to the trapezius. They attach through C7 to T5, the spinous processes, and the lower part of the ligamentum nuchae, the vertebral border of the scapula between the inferior angle and the root, and they retract. They also participate in the force couple for downward rotation, and they have that little bit of a vertical line of pull because their line of pull is a little bit oblique, and so they can elevate the scapulae as well. Dorsal scapular nerve, just like the levator scapula. So the shoulder complex is complex, if you want to say it that way. It's one of the most complex musculoskeletal systems in the body. Really, if we want to get proper motion of the shoulder joint, it requires the coordinated action of many muscles across multiple joints. And so shoulder dysfunction is common. We are treating people for shoulder dysfunction a lot in the clinic. So the same factors that make shoulder dysfunction common also make the shoulder complex highly adaptable. So it's sort of like it's its strength and its weakness, its complexity. So I just think the shoulder is a really interesting joint, and I hope you love it, because no matter what setting you work in physical therapy, you're going to be treating shoulder problems.